Hello everybody and welcome to the Tuesday edition of Video Clips, and I, as usual, have a few announcements. The first thing is the actual first class of the Advanced Studies series for January started last night. It's based on Radical Remissions, the book by Dr. Kelly Turner about cancer patients who survive against all odds. So you can still listen to the recording for that and pick up the second portion of this training, which happens toward the end of the month. This is a fascinating book. I have learned a great deal from it, not only about how cancer patients can survive, but also how the rest of us can stay healthier and not end up being cancer patients, just as valuable. This week's members website posting will be Exercise with Chris. Top 3 exercises to improve posture, something we should all benefit from, because the better we sit, and we all sit all day long, there's no way around it, most of us anyway, but the better your posture when you sit, the less likely you are to have injuries and pain and all that sort of thing. School starts next week. January 19th is the first day of classes, so if you're planning to take some classes through our institute, you need to get in touch with us right away. And training class for the first group of Wellness Forum healthcare providers starts this Saturday, so if you're planning to do that, you need to get in touch with us right away about that as well. All right, I picked a couple of topics that I want to discuss today. The first one, which is timely because it involves fevers, and since it's cold and flu season, a lot of people have a fever, so here's the deal. It's considered common wisdom to take drugs to lower fever during colds and flu. 3 types of drugs generally sold over the counter for this purpose, and those are aspirin, Tylenol, and NSAIDs. But in most cases, as it turns out, it's counterproductive to lower a fever because fevers actually help speed up healing. Studies have shown that there are risks with the drugs that are used to lower fever, and they range from bleeding, liver damage, and then increased risk of atrial fibrillation and cancer. And I'll just refer you to other articles in the Health Briefs online library that talk about this in more detail, but there's quite a bit of evidence that these drugs aren't good for you. The risks of taking them might be worthwhile if the drugs help to reduce symptoms or duration of illness, but research shows that this is not the case. In fact, taking aspirin, Tylenol, and ibuprofen increase both the severity and duration of nasal symptoms in adults with colds. Now, why would this be? Well, as it turns out, fever is just one component of an immune response, which includes activation of several systems. The activity of leukocytes, macrophages, T lymphocytes are all increased, all of which help to fight infection. The other thing is increased temperatures, when they reach a certain level, prevent viruses from replicating. So when you lower body temperature artificially, and I'll put out the caveat, and I'll return to this in a minute, that there are times when you need to do that, but in general, when you lower body temperature, you're interfering with the immune response, and you're creating a more favorable environment for viruses in particular to thrive. Now, what drives a lot of people to take drugs to lower fever is the incorrect idea that the fever is the cause of the unpleasant symptoms that they're experiencing, and that if they lower the fever, they'll get rid of some of those symptoms. But the reality is there's not a single randomized trial that has ever measured whether or not lowering a fever actually reduces symptoms and to what degree somebody might expect to feel better. There is quite a bit of evidence showing that people who have higher temperatures fare better in a number of different circumstances. For example, pneumonia patients with higher body temperatures and higher leukocyte counts had a mortality rate of 4%, while those with no fever and lower cell counts had a 29% mortality rate. And studies have shown that higher temperatures help in the healing of injuries due to trauma, recovery from infectious diseases like chickenpox and many other conditions. Now, again, I'll return to the caveat. There are situations and exceptions to what I'm talking about, and particularly sick children, and particularly the younger they are, should be watched really, really carefully. And there is a point in time when you have to do something about it. But the point that I'm making here is the knee-jerk reaction, particularly in the case of adults who are anxious to lower their temperature as soon as they're diagnosed with colds or flu or experience symptoms, is just really not helpful and does not help them get better faster. In fact, it can prolong illness. All right, so speaking about patients' misunderstanding about healthcare in general, we'll make this a broader topic this time. According to a recent study, patients overestimate the benefits of medical treatment and they underestimate the potential harms. Now, this is not surprising because most of the time doctors only talk to patients about benefits. They never sit down and say, well, these would be the good things that would happen, but just to have a balanced discussion, let me inform you about the harms. Now, there are reasons for this, one of which is that sometimes doctors aren't even aware of the harms. Doctors receive a lot of training and they are influenced heavily, in many cases, by drug and device makers, and they tend to repeat what is told to them. And what makes it even worse is that the information is presented to them and then repeated to the patient in relative rather than absolute form, which means that many treatments and tests look a whole lot better than they actually are in practice. Even when patients question docs, they sometimes don't get right answers. Our members are pretty well trained to ask a lot of questions and engage in what we call an informed consent discussion with their doctors, and it's amazing how many of them have brought information. They take careful notes, bring the information back here, and we just get online and start looking at journal articles together and see that what they've been told is just patently false. Some of our veteran members are able to do this on their own now. They don't even need to come in and talk to us about it. They can get online, read the articles, and see that there was misrepresentation involved. So the authors of the review that I referenced earlier report that this whole situation I've just described interferes with patients' ability to make informed decisions, no kidding, and it's related to the increased costs of medical care. They wrote, overly optimistic intervention expectations by patients and the public are undoubtedly contributing to the growing problem of overdiagnosis and overtreatment. So for this particular research study, they identified 36 articles reporting the results of 35 studies that involved over 27,000 patients. And what the patients were asked to do in all of these studies was to estimate the benefit or harms of tests, screenings, or treatments. There were only 2 outcomes for which the participants were able to accurately estimate benefit, and that was improved vision after cataract surgery and the accuracy of Pap tests to reduce the risk of dying of cervical cancer. At least half of the participants underestimated the potential harm for tests and treatments, and for some outcomes, the underestimation was stated in 97% of participants. Correct harm was estimated for only 2 outcomes: the percentage of people who still need glasses after cataract surgery and the increased risk of miscarriage from amniocentesis. The authors stated the obvious, and that is that people who believe that tests and treatments are effective are more likely to ask for them. And the fact that so many doctors and clinicians will just consent to offer tests and treatments when patients ask causes this terrible feedback loop where the consenting without any type of informed decision-making discussion reinforces the patient's belief about tests and treatments being beneficial and necessary and without any potential harm. The authors suggest that shared decision-making based on, quote, evidence-informed discussions can help patients to construct informed preferences. Well said. Now, this situation is going to continue until more patients know how to ask questions, look at everything that's offered to them with a great deal of suspicion until proven absolutely to be the right thing to do, and until more health practitioners learn that there are downsides to a lot of the things that they're recommending and learn how to have these informed consent discussions. Now, you've heard me talking a lot lately about Wellness Forum Healthcare, our new model of healthcare that not only incorporates the use of diet, but also incorporates this broader vision of what healthcare is about, which is informed decision making. And that's what we're endeavoring to do here. We've been doing a really good job training patients and members of the Wellness Forum to engage in these types of discussion. But my gosh, we got to get the whole population up to speed, and we've got to have tens of thousands of providers who are understanding this type of thing that I've been discussing and capable of engaging in those discussions too, before we can expect costs to come down and for the trend to become different in terms of where healthcare is going. But we're determined that that's one of the things that we're taking on. We're going to make it work, and you'll get some exciting news from us this year as we start all of these new things in motion toward this model of healthcare. All right, that's all for today. As always, pass this on to anybody who you think would enjoy watching it, and I'll be back to you again on Thursday with more news.